Well, I tell you what's nice to have the 3D technology with cone beam imaging into our practice. We're able to keep more procedures in-house. Maybe some implant placements that we previously refer out, we're able to keep those in. Doing a lot more with sleep apnea treatments now, getting some actual airway measurements to help our pulmonary docs rely on oral appliance therapy for their patients that can't tolerate CPAP or just have a phobia to sleeping in a wind tunnel at night. So those kind of procedures, having the validation with the technology has been great. I think one of the big questions that has really been validated at this conference has been the risk that we take as clinicians. That if we acquire an image, we had a wonderful judge, an orthodontist, speak to us about how we're not really held responsible for issues outside of our expertise. And, validation again on what low radiation there is with cone beam compared to spiral CTs and hospital base.
Well, there hasn't been any cases that have gone to court that has litigation against a dentist not seeing something that's outside of their expertise. Really gives confidence that we can go ahead, look at our diagnostics, and kind of remove some of the fear that we have about missing something that we may not have had any training about. I think so. I really believe that all scans need to be read. Whether you take the time to educate yourself to the anatomy that we're looking at, and if there's any question, absolutely send it out for oral maxillofacial radiologist review. And informed consent, give your patients the ability to make a decision whether or not they want it to be read for medical conditions. And so that was brought out at this meeting. It's very important for all of us. Well, when we sit down to do a treatment plan consultation with the patient, when we can bring up their skull, when we can rotate it 360 degrees around, when we can show them areas of concern, we can give them options for the surgical procedure for placing implants. It's just amazing on the confidence factor that it instills into your patients of having that.